2, 1, it's official.
The Ministry of Health will conduct a national household survey to, among other things, assess the progress of Uganda's national HIV response and ascertain the latest disease burden in the country.
The first one is to estimate the HIV prevalence in this country among people aged 15 years and above. The second one is to estimate the prevalence of viral load suppression among people that are HIV positive, again in the same age group. And the third objective is to assess progress towards the UNAIDS 95-95 target.
Current statistics indicate that Uganda today has an estimated 1.5 million people living with HIV, of which 1.4 million are on treatment.
The UFIA 2024-2025 will also include secondary assessments to estimate the prevalence of elevated blood pressure and elevated blood glucose. These are new additions to our FIA menu, including obesity among the general population and people living with HIV.
The 8-week-long survey, funded by the US government to a tune of 37 billion shillings, will be implemented by local partners, including Makerere University School of Public Health.
This survey builds on capacity in-house within Uganda that can do very high-quality surveys, and we don't take that for granted. I can say with confidence that we are going to deliver a quality survey.
In this era of shrinking global HIV funding, data becomes a valuable currency. It ensures that every decision, every intervention, every dollar is directed where it will have the greatest impact.
US Ambassador to Uganda, William Pope, explained that the survey will give critical information on the progress and impact of ongoing interventions.
Of course, we need to make sure that services effectively reach those most in need, and to do that, we need good data and good research. This information is fundamental not only to the ministry's work, but to our work as a partner of the ministry in adjusting our programs to align them with the needs of the Ugandan population.
The Minister of Health, Dr. Jane Ruth Acheng, notes that in the country's 3 decades of fighting the disease, great strides have been realized, including reducing the adult prevalence in the country from 7.2% in 2010 to 5.1% in 2023, reduction in mother-to-child transmission and HIV-related deaths.
AIDS-related deaths have also dropped significantly from 53,000 in 2010 to 20,000 in 2023, representing a 62% reduction.
She says despite these successes, great challenges still abound, hence the need for new data to inform future interventions.
The findings will serve as a baseline for tracking our progress towards achieving this national and global goal. To all Ugandans, I urge you to welcome our field teams, participate honestly, and support this national effort.
The ministry, together with all partners, expressed confidence that with accurate data, focused leadership and community support, Uganda is on the right path to ending HIV as a public health threat by 2030. I'm Benjamin Jumbe, NTV.